Good afternoon. I want to thank you all for coming here today. We very much appreciate your time and the opportunity to provide information regarding coronavirus 19, or what I may refer to as COVID-19. I want to introduce a few people here with me today. To my left, Dr. Tom Boyd, Medical Director for Emergency Medicine. Dr. Wes Alexander, Assistant Medical Director of Inpatient Medicine. Dr. Stu Reynolds, Director of Critical Care Services. Dr. Mark Bingham, Medical Director for Telehealth. Dr. Michelle Carney, Medical Director for Infection Prevention. And Dr. Eddie Katemba, Medical Director for our Intermediate Care Centers. They are representative of the medical leadership across our entire system. Clearly, we couldn't have all of us here today to speak with you, but I think if you've got questions, we'll be happy to answer them as they come. My name is Chris Lombardozzi. I am Chief Medical Officer for Quality and Vice President at Spartanburg Regional Healthcare System. I've been here for about 16 years now and held a variety of roles, including Medical Director of the Emergency Department several years ago. I want to assure the public and our staff and all of our providers that we are well prepared for the coronavirus, whatever the future holds. And we'll talk about that in a moment. As information about this novel coronavirus continues to flow from a variety of sources, we wish to provide reassurance that Spartanburg Regional Healthcare System is prepared to meet the needs of our communities in providing the highest quality of care in a safe environment for all of our patients, families, and caregivers. As you're all aware, there's been a widespread outbreak of coronavirus, COVID-19, in China, and of course with several other countries, including Iran, South Korea, Italy, and of course some cases here in the United States. Virtually all of the worldwide cases had direct contact to people in China and Wuhan province, or have had direct contact with other people who have known coronavirus confirmation. That said, according to the CDC, the Centers for Disease Control and Prevention, most of the fatalities related to this virus have been in people with older age and with underlying conditions such as diabetes and lung disease. Governments all over the world have enacted a variety of containment measures to reduce the risk of exposures and hinder the spread of the virus. And despite those measures, the CDC does expect that more people in the United States will contract the virus over the next several weeks to months. There's no way to predict the future, but clearly we've already had several cases in the United States, and there's a high likelihood that we'll have more. Spread of the virus occurs by person-to-person contact through droplet transmission. That would be sneezes, coughs. Respiratory symptoms like cough, fever, shortness of breath can be very mild, or they can be very severe. To date, there is no cure, and there's no specific medication to treat this illness. When patients are sick, we provide supportive care until they recover. Current CDC guidelines stress that supportive care. And fortunately, most of the people who contract this virus have had mild symptoms and have not even required hospitalization. Our organization closely follows the CDC and DHEC for guidance. And all patients who present to our facilities, regardless of which facility they come to, should certainly be expected to answer questions about worldwide travel, about contacts, and if they have symptoms, respiratory symptoms like a cough, a cold, sneezing, fever, then we'll ask them to put a mask on when they present to our facilities. The hope is that by doing that, we can prevent further contact and spread of the virus if it should occur here. And I should say that that's the same process that we have right now for any respiratory illness, including the flu. So the procedures that we have had in place for quite some time are the same that we have now for coronavirus. General guidelines, and I think it's important to mention these things, general guidelines, whether you're a healthcare worker or just someone out in the public, are really the same. There's no prevention measure that's 100% perfect, but you can reduce your risk by doing a few things, and they're pretty simple. Avoid close contact with people who are sick. That seems pretty obvious. It's what you do at home. If someone has a cough or cold or the flu, we want to avoid close contact with those folks. You want to avoid touching your eyes, your nose, or your mouth. Again, those are things that we tell people all the time to prevent respiratory illness. Stay home when you're sick. Your boss will understand. It's okay. Call in, tell them you're sick, stay home until you're feeling better. And lastly, cleaning and disinfecting frequently touched objects and surfaces using a regular household cleaning spray or wipe is perfectly fine. When you're coughing, I'm sure the kids out there will appreciate this. Do the vampire move. Let's see you do that. Cover up that cough or that sneeze and prevent the spread of those droplets. I'm going to answer a couple of common questions that have come up over the last couple of weeks, and then we'll take your questions. I would also say that, as I said before, we continue to follow the DHEC and CDC recommendations very, very closely. We stay updated on anything that comes out from the CDC or DHEC on a regular basis, and we'll continue to do that in the future. So some common questions that we've noticed from families, from staff, from the general public. What are the symptoms of coronavirus? Well, those symptoms are common respiratory infection symptoms. They include fever, cough, shortness of breath. For confirmed cases, these illnesses have ranged from very, very mild. In fact, many people may not have even known that they had it, up to severe illness. And of course, in a few cases, there have been some deaths. What's the incubation period? It's hard to know exactly, but according to the CDC, it can be anywhere from a couple of days up to, say, 5 to 7 days. And the symptoms may appear as early as a couple of days up to 14 days after exposure. And I think that's where that guidance towards the folks who came from Wuhan province were asked to be put in areas where they were going to have minimal contact with other folks for about 2 weeks. What can I do to prevent getting the virus? Well, there's no such thing as perfection here, and whatever we tell you, it won't be 100% perfect, but you can definitely reduce your risk by avoiding close contact with folks who are sick, avoid touching your eyes, nose, and mouth, stay home when you're sick, cover your coughs and sneezes, use a tissue, throw the tissue away when you're done with it, don't just put it back on a table somewhere, and clean and disinfect frequently using common cleaners that you have at home. Should I use a face mask? Currently, the CDC does not recommend that people who are well wear a face mask to protect themselves from respiratory diseases, including COVID-19. Those face masks should be used by people who show symptoms of COVID-19 only to help prevent the spread of the disease to others. The use of face masks is crucial for healthcare workers who have close contact who will be caring for these patients. And certainly, if you are taking care of someone at home who had this, then we'd also encourage the use of face masks per the CDC guidelines. How should I wash my hands? That one may sound really simple, but what I'd like to emphasize is that effective hand washing takes 20 seconds. And 20 seconds is actually a fairly long time. Wash your hands often, soap and water, 20 seconds, and especially after sneezing, coughing, going to the bathroom. You can use soap and water. If that's not readily available, then an alcohol-based sanitizer is fine. Those are commonly available. I think virtually everybody has at least one or two lying around. Always wash your hands with soap and water if your hands are visibly dirty. Is there a cure? No, there is not. Currently, there is no cure. If you're following the news, then you know that there are attempts out there to create vaccines and potential cures, but according to the CDC, it will be quite some time before any of that is available. Like many respiratory viruses, however, the CDC recommends supportive care and treatment of any of the underlying conditions. National and international agencies are working with private companies to develop treatments and vaccines, but as I said, it will probably be many months to years before those are available. according to their updates. Who should be tested? It's a great question. We get that quite a bit. Should I get tested for COVID-19 if I've got cold symptoms? And the answer is no. There are CDC recommendations out there. If someone has had recent travel to China or close contact with someone known to have the illness, to have COVID-19, and has fever, cough, or shortness of breath, then that person should be isolated in a private space with a face mask while the health department is contacted and an assessment is made on the need to collect specimens for testing. Healthcare workers and other caregivers should wear appropriate personal protective equipment for respiratory illness. There are multiple areas to find updates, and I would encourage the public to get familiar with the CDC and DHEC websites. They maintain all of the facts and figures as we currently know them, and as updates become available, or if new guidance becomes available, that will be the first place to find that information. And with that, I will be happy to take your questions.